Khechari Mudra, a comprehensive exploration of the ancient yogic practice. Khechari Mudra, often revered as the king of mudras, is an advanced yogic technique with roots in Hatha Yoga, Kriya Yoga, and Tantric traditions. This practice involves intricate manipulation of the tongue to stimulate energy pathways, access metaphysical states, and promote physical and spiritual well-being. Historically documented in texts such as the Hatha Yoga Pradipika and Gheranda Samhita, Khechari Mudra remains a subject of fascination and reverence among yogic practitioners. This report synthesizes historical context, technical execution, physiological and spiritual benefits, risks, and modern interpretations to provide a holistic understanding of this profound practice. Historical and philosophical foundations. Origins in yogic literature. Khechari Mudra, Sanskrit Khechari Mudra, derives its name from Khe, sky, ether, and Chari, to move, symbolizing the practitioner's transcendence of physical limitations. Early references appear in medieval Hatha Yoga texts, where it is described as a means to seal bindu, vital energy, in the head, preventing its dissipation and enabling the consumption of amrita, nectar, a metaphysical substance associated with immortality. The Khechari Vidya, a 14th century Tantric text, elaborates on its role in raising Kundalini energy and accessing hidden reservoirs of amrita. Mythological and symbolic significance. In yogic cosmology, Khechari Mudra is linked to Shiva, the archetypal yogi, who transmitted the technique to select disciples. The practice is said to facilitate samadhi, union with the divine, by unifying pranic currents in the body. Symbolically, the tongue's journey into the nasal cavity represents the soul's ascent beyond material confines, echoing themes of liberation, moksha, central to Hindu philosophy. Technical execution. Stages and practices. Preparatory techniques. Mastering Khechari Mudra requires gradual preparation. Talabya Kriya, a tongue-stretching exercise, is essential for enhancing flexibility. Practitioners repeatedly stretch the tongue upward and backward, often over months or years, to elongate the frenulum. Some traditional texts advocate controlled cutting of the frenulum, though modern practitioners widely discourage this due to risks of injury and speech impairment. Step-by-step progression. 1. Nabho Mudra, preliminary stage. The tongue touches the hard palate behind the upper teeth, activating salivary glands and preparing the musculature. 2. Stage 1. Soft palate to uvula. The tongue curls backward to contact the soft palate and uvula, often aided by simulated swallowing or gentle finger pressure. 3. Stage 2. Post-uvular engagement. Advanced practitioners learn to maneuver the tongue past the uvula into the nasopharynx, sometimes utilizing breath control, ujjayi pranayama, and locks, bandhas, to stabilize the posture. 4. Stage 3. Nasal cavity entry. The tongue enters the nasal cavity, purportedly stimulating the pituitary gland and facilitating the flow of amrita. Associated practices. Breath control, ujjayi pranayama, victorious breath, is often synchronized with Khechari to enhance focus and energy flow. Bandhas, Jalandhara, throat lock, Mula, root lock, and Uddiyana, abdominal lock, are employed to direct prana upward. Meditative focus, gazing at the third eye, Shambhavi Mudra, synergizes with Khechari to deepen meditative states. Physiological and spiritual benefits, physical health, endocrine stimulation. Pressure on the soft palate and nasal cavity may activate the pituitary and pineal glands, regulating hormones linked to metabolism and stress response. Immune enhancement. Traditional claims suggest immunity to toxins and diseases, though empirical evidence remains sparse. Digestive and respiratory benefits. Reduced salivation and controlled breathing may improve respiratory efficiency and metabolic regulation. Spiritual and psychological effects. Kundalini awakening. The mudra is said to channel prana through the Sushumna Nadi, awakening latent spiritual energy. Cognitive clarity. Practitioners report heightened focus, intuition, and emotional equilibrium, attributed to reduced sensory distraction. Transcendental states. The consumption of amrita is metaphorically linked to blissful absorption. Unmani-avastha, a precursor to samadhi. Risks and controversies. Frenulum modification. Tradition versus safety. Classical texts like the Hatha Yoga, Pradipika, describe incremental frenulum cutting to lengthen the tongue. However, modern authorities, including Swami Sivananda and Paramahansa Yogananda, emphasize stretching over surgical intervention due to risks of hemorrhage, infection, and permanent dysfunction. Common challenges: gag reflex and discomfort. Initial attempts often trigger gagging, watery eyes, or throat irritation, necessitating gradual adaptation. Overstimulation. Excessive practice may cause dizziness or anxiety, particularly if pranayama is poorly regulated. Ethical and practical considerations. The pursuit of supernatural powers, siddhis, such as immunity to poison or survival without food, is discouraged in orthodox yoga, which prioritizes self-realization over material gains. Modern adaptations and scientific insights. Neuroscientific perspectives. Stimulation of the nasopharyngeal region activates the vagus nerve and hypothalamic pituitary axis, potentially explaining reported effects on mood and autonomic regulation. fMRI studies suggest that tongue positioning may modulate default mode network activity, correlating with meditative depth. Integration in contemporary yoga, Khechari Mudra, is often simplified for safety. Nabho Mudra, tongue on hard palate, is widely taught as an accessible alternative, offering partial benefits without anatomical risks. Hybrid practices combining Khechari with mindfulness or biofeedback are emerging in therapeutic contexts. Practitioner experiences and community insights. Anecdotal accounts. Reddit communities. Users report mixed outcomes. Some achieve nasal insertion through persistent stretching, while others find Nabho Mudra sufficient for mental calm. Yoga instructors. Emphasis is placed on patience, with one teacher noting, "The fruits come from the journey, not the performance of the mudra." Paramahansa Yogananda's legacy. Yogananda integrated Khechari into Kriya Yoga, framing it as a tool for redirecting prana from the senses to the spine, facilitating union with the universal spirit. His disciples caution against premature experimentation, advocating guru-guided practice. Conclusion. Synthesis and recommendations. Khechari Mudra embodies the intersection of ascetic discipline and metaphysical aspiration. While its physical mechanics are anatomically grounded, its spiritual promises, immortality, ecstasy, and liberation reflect humanity's enduring quest for transcendence. Modern practitioners are advised to 1. Prioritize safety. Avoid frenulum cutting. Opt for gradual stretching under expert supervision. 2. Integrate holistically. Combine Khechari with pranayama, meditation, and ethical living. Yamas, niyamas. 3. Embrace moderation. Recognize that partial practice, e.g. Nabho Mudra, can yield significant benefits without undue risk. As yoga evolves, Khechari Mudra remains a testament to the interplay between tradition and innovation, inviting ongoing exploration into its physiological correlates and transformative potential. This report synthesizes insights from classical texts, modern adaptations, and practitioner accounts to illuminate Khechari Mudra's enduring relevance. Further interdisciplinary research is needed to validate its mechanisms and optimize its application in contemporary wellness paradigms.